This is 2015, blue is 15, orange is 2016, 17, 18, and 19. And what we have done is we do these full encompassing surveys every other year, and then the orange and yellow were in between years where we did what we call a pulse survey. So rather than spend the money and you got to have the time to see if your initiatives are working, we would do just sort of little pulse check-in kind of surveys. So, you know, the axis is really, the colors are the fiscal year that we work in. I think somebody over here.
Yeah, this is just a small point about the slide 2. On your increase in profit of 20 whatever percent, is that adjusted for inflation cost in the cost of health care?
So that did not, that was net revenues, all right, what we actually collect, and it did not include our price increases each year. So in healthcare, you set a charge and then everybody negotiates what they pay you. Yes?
What do you see as the greatest challenge to a patient?
People can't hear the other end.
What do you see as the greatest challenge to a patient?
I think that understanding the complexities of the system and how to navigate it. You know, I always tell my children, like, try to learn the healthcare system before you get sick. You know, try to make sure you understand your providers, make sure you have an electronic health record, make sure you know what you're going to do. And that's what I spend a lot of time helping my friends with, is navigating the healthcare system. I think when people come to a hospital, they assume that the clinical side of the house knows what it's doing. You know, you're not going to walk in and say, unless you're a vascular surgeon, you're not going to be able to challenge a vascular surgeon about how he's going about opening your carotid. But you'll comment about how easy it was or not to make your appointment. You'll comment about the food. That's something that you know. You'll comment on whether someone smiled at you, whether the doctor sat down next to you to explain to you what was going on or hovered over you and told you what was going on. It's the simple little things. And I think from my perspective, that's the stuff we have to teach the workforce. And then from the consumer side, we have to make it easy and understandable and be better educators about how to navigate healthcare, because most people navigate it when they're vulnerable, not when they're at their best.
I thought that I read or heard a couple of years ago that there were some issues recruiting certain doctor specialists. For instance, I think I heard you say one time, dermatologists don't grow on trees. I heard somebody say, maybe it was you, maybe it was somebody else. Have you had issues recruiting specialists?
Sure. I mean, I think across the country, recruitment of physicians is very difficult. You know, I mean, Geisinger would be a better person to talk to. They recruit at an incredible rate, and they've come up with a strategy to acquire a medical college and begin to figure out how to train primary care physicians and tie them appropriately to their system. But physicians can find jobs any place. You know, we'll just stick with the United States. I mean, you can really go anywhere, but in the United States, physicians have tons of opportunities. And so when you're a place like me, you have to work at talking about the things that would attract somebody to this kind of region. And candidly, most of the physicians that I employ were trained at Geisinger. They were from this region, or they married somebody from this region, or they had a relative who was a provider from this region who said, this is a great place to raise a family. And a lot of them have ties to Bucknell. And so those are the things. And it is, once you get people here, it's very easy to recruit to Lewisburg. And so, you know, I'm happy about that. But there are shortages all over the place. There's shortages in primary care, shortages in simple dermatology, you know, OBGYN. I mean, you name the specialty, you can find it. Geisinger spent years recruiting in neurology and finally, you know, got back. But it takes years sometimes to get to the complement of providers that you need. You know, we tried forever to get an endocrinologist and then finally found a really good endocrinologist, but it took us forever. We had a pulmonologist, lost that person, and we have not been able to fill that slot ever since, which again is why we try to work cooperatively with the other organizations around it, whether it is UPMC, whether it's Penn State Hershey, or whether it's Geisinger. We work collaboratively with people to make sure our patients get what they need, but recruiting just nationally is a challenge.
I think we're out of time, Kendra. Thank you so much.
Thank you all very much. I appreciate it.
I think Kendra's going to be here for a little bit. Anybody has questions, wants to visit with her one-on-one, she said she'd be around for a little bit. Patty Johnston from the nominating committee reminded me that they have begun work. The committee of three has been meeting, and they would really like to talk to anyone who has an interest in serving on the board, has questions about what that involves, and they're preparing job descriptions, and they're really, I think, approaching their job this year in a very fresh and different way. So please see Patty, Roberta Green, who's not here, and Candy Duncan is also on that committee, so see any of those people. And lastly, as Becky invited you all to stay for our Town Hall #1 to be repeated again on December 19th, 7 p.m. at East Buffalo Building. If you can't stay today, or you know other league members who have comments and are interested. So thank you for coming today, and thank you to our speaker, and please stay and mingle a bit.